Hi, I hope you're well. Today, I want to share with you a very dark secret of the health industry, a secret that not even most doctors know about. Secret is related to vitamins. I'm sure you've heard about vitamins and how essential they are for our life. They're needed in small quantities for keeping us healthy and a normal, proper functioning of our body. But there's a darker side to it. There's a type of vitamins which is toxic to our health and can increase the risk of cancer. This is the type that we are going to demystify and talk about today. When it comes to vitamins, there are many types of vitamins. You must have heard of the A, B, C, D, E, and K vitamins. There are many types of vitamin Bs, and these are found abundantly in nature. You can find them in fruits and vegetables, in milk and egg, and almost every and any kind of food that we eat, including drinks like coffee. But there is another kind of vitamin, a sinister kind. And these are the synthetic vitamins, which are made by pharmaceuticals and drug companies. These vitamins come in colorful capsules and tablets and liquids and sometimes in powder form. And we are all exposed to them. You'll be surprised to know that most of us take these vitamins unknowingly. The synthetic vitamins are added to our food as nutritional supplements. And these fortified, supplemented foods are found almost everywhere. The dark secret and shocking news about vitamin use is that although the natural vitamins found in fruits and vegetables reduce the risk of cancer and are generally very good for health, including prevention of diseases such as heart disease, the synthetic vitamins can increase the risk of cancer. And this has been shown in trial after trial done over the last 20 to 30 years. Now, you might be asking me, where is the evidence? How could you claim that the synthetic vitamins can cause an increased risk of cancer compared to the natural ones? To look at the evidence for synthetic vitamins, I have done a lot of literature search and found out many trials for you, which I'd like to share. But before we do that, let me tell you how we are going to look at the evidence. We are going to classify it into three groups. From a cancer specialist point of view, there are three kind of people in the world. Those who have cancer, those who are at low risk of cancer, and those who are at a high risk of cancer. So we are going to see the evidence in all these three categories. Starting first with the category of people with a low risk of cancer. It was the year 2006, and there were two trials going on in Norway. The first one is known as the Norwegian vitamin trial, the NORVIT, and the other one, the VENVIT, the Western Norwegian Vitamin Interventional Study. Both of these trials were looking at giving synthetic vitamins to patients to reduce the risk of heart disease. But what they found was quite shocking. Not only the risk of heart disease was not reduced, the risk of cancer went high among their patients. In 2009, another trial was conducted known as the SELECT trial. This trial was based on the well-known fact that selenium and vitamin E reduce the risk of prostate cancer, especially when taken in natural form in fruits and vegetables. Hence, the pharmaceutical industry was quite keen to jump in with synthetic vitamin E and selenium and wanted to see if they could market them as a cancer preventing supplement. But the results were once again quite negative. Synthetic selenium and vitamin E increased the risk of prostate cancer rather than decreasing it. And these findings were statistically significant. Now, I'm not a statistician, but if you are one or you know a friend who is, please do ask them about the p-values. The p-value in the trial was 0.008, which means this was not happening by chance, but there was a strong link between taking synthetic selenium and vitamin E supplementation and the increased risk of prostate cancer. Let's come to the next category of people, who are at an increased risk of cancer because they're exposed to cancer causing risk factors such as smoking. In 1994, a trial was conducted on such people, and smokers were given vitamin supplements. The result was quite disastrous. The risk of dying from lung cancer increased. In 1996, another trial was conducted. This time, multiple types of synthetic vitamin supplements were again given to smokers in the hope that it would reduce the risk of lung cancer and reduce death from lung cancer. But the very opposite happened. In 2007, a folic acid supplementation trial was carried out in which folic acid supplements were given to a large number of patients in the hope to reduce the risk of bowel cancer. But what the researchers found was that precancerous lesions, polyps in the bowel, increased with folic acid supplementation. And not only that, there was a bonus finding, a kind of a bonus which nobody wants, an increased risk of prostate cancer in patients getting folic acid supplementation. Now, all of these trials are based on the valid and objective evidence of natural vitamins reducing the risk of cancer when taken in form of nutrition like fruits and vegetables. However, whenever the pharmaceutical companies come with concentrated form of synthetic vitamins, the risk of cancer goes high. Let's move to the third category of people, people who already have or had cancer. What happens when we give vitamin supplements to them? Trial after trial has shown that giving synthetic vitamins to people with cancer or who've recently recovered from cancer does not benefit them. When it was tried in breast cancer patients, many of the trials have shown that taking synthetic vitamin supplements, including vitamin A, vitamin C, vitamin E, and vitamin B complex, increases the risk of cancer coming back and also increases the chance of dying from breast cancer. So, why is this happening? I hear you ask. If you take the same vitamins in the natural form, fruits and vegetables, the risk goes down. But when you take them in the form of synthetic vitamins, the risk goes up. And for answering this question, we have to go back to the definition of the word vitamin. Vitamin is an essential nutritional element which is required in small quantities. And I like to stress on this, small quantities for proper and healthy functioning of the body. And that's exactly what the fruits, vegetables, and other sources of nutrition provide us. Fruits and vegetables, especially, have quantities of vitamins which are adequate for our body. They are slowly released, and the body only takes what it needs. But when you go to synthetic vitamins, the opposite happens. They are highly concentrated forms of synthetic vitamins which are fast released, and the body is forced to absorb more than it needs. When we are in a growing age, like in our childhood or early teenagers, we can use all the vitamin in the world and use it for a better growth, getting taller and bigger and stronger. But after a certain age, our body stops growing. And the only fast growing cells in the body are damaged, mutated, precancerous or cancer cells. Remember, every day in every normal human being, and I'd like to stress on it, every normal healthy human being, we have 800 to 1000 mutated cancer cells born, and the body kills all of them and makes us cancer free. But if we are giving extra nutritional supplements to these cancer cells or precancerous cells, which are baby cancers and can bloom into full blown tumors, we make it more difficult for the body to attack them and to defend us against them. So you are feeding the cancer at one end and the body is trying to kill it at the other. This is the dilemma of synthetic vitamins and the reason why synthetic vitamins can increase the risk of cancer, and not only one or two type of cancer but many